Autonomic neuropathy. A production of GoodHealthTube.com. What is the autonomic nervous system? Autonomic neuropathy is a serious and somewhat complex disorder that affects the autonomic nervous system. The autonomic nervous system is a network of nerves that regulates and controls the unconscious functions of the body. It controls the functions of the internal organs, such as the heart rate, digestion, and the sweat glands. By regulating these bodily functions, the autonomic nervous system contributes to the maintenance of homeostasis in the body. Homeostasis is the state of keeping the body systems in equilibrium. What causes autonomic neuropathy? Autonomic neuropathy can be caused by a variety of diseases or conditions such as diabetes, alcoholism, shingles, amyloidosis, abnormal protein build-up in organs, carpal tunnel syndrome, Guillain-Barré syndrome, GBS, and multiple sclerosis. Diabetes is the most common causes of autonomic nerve damage because high blood sugar levels can damage nerves and blood vessels throughout the body. Other medical conditions such as autoimmune diseases including systemic lupus erythematosus and rheumatoid arthritis are associated with autonomic neuropathy. There are some rare inherited diseases that can also cause autonomic neuropathy such as familial dysautonomia. Infections that can cause damage to the nerves include Lyme disease and HIV. What are the symptoms of autonomic neuropathy? The symptoms of autonomic neuropathy are associated with the nerves that regulate involuntary bodily functions like blood pressure, heart rate, digestion, urination, and perspiration. This damage from autonomic neuropathies can affect various organs and body functions throughout, resulting in a wide range of mild to severe symptoms. Early symptoms include dizziness, lethargy, and exercise intolerance. Other symptoms of autonomic neuropathy and autonomic dysfunction may manifest as fatigue, lightheadedness from too low a blood pressure, vertigo, digestive system symptoms such as nausea, vomiting, and constipation. Early satiety, which is feeling full after eating only a few bites, can occur and can lead to unwanted weight loss. Difficulty urinating, maintaining bladder control and other urinary symptoms such as urinary incontinence resulting in leaking urine can occur, which can develop into urinary tract infections and sepsis. In some individuals, autonomic neuropathy can cause high blood pressure. Autonomic neuropathy can result in sexual symptoms resulting in abnormal sexual function such as erectile dysfunction and vaginal dryness from impaired sweat glands. Occasionally, the symptoms can be life-threatening, such as fainting from orthostatic intolerance, which is the inability to maintain adequate blood pressure when standing from a seated or laying position. A lethal cardiac symptom from damage to the autonomic nerves is death without the warning signals of feeling chest pain from an abnormal cardiac rhythm. How is autonomic neuropathy diagnosed? The first step in diagnosing autonomic neuropathy is a physical examination where the doctor will ask about one's medical history and check for signs of nerve damage. The doctor may also perform specialized tests like an ECG, electrocardiogram, to measure electrical activity in the heart, or an MRI, magnetic resonance imaging, to assess nerve damage in different parts of the body. Blood tests may also be conducted to look for any abnormalities related to metabolic disorders, such as an elevated blood sugar in diabetes, or other disorders that could be causing organ damage from autonomic neuropathy. Autonomic testing to check for functions of your sweat glands, known as a thermoregulatory sweat test, may be performed. Checking for autoimmune disease may be indicated as well. There are several other tests that a physician can order. How is autonomic neuropathy treated? Identifying the underlying causes of autonomic neuropathy is the first step in the appropriate treatment. Your physician may order tests to determine whether diabetes or another condition is causing your symptoms. These tests typically fall under the field of clinical neurology. Treatment will depend on the underlying cause of the disorder, but may include dietary or lifestyle changes, medications such as insulin or antispasmodics for the digestive system, physical therapy, surgery, or alternative treatments such as acupuncture and massage. Several medications are available for the treatment of autonomic neuropathy. Alpha-2 agonists such as clonidine, which relaxes blood vessels, can be used to treat autonomic neuropathy-related hypertension. Antidepressants such as amitriptyline, which alleviates the disorder's associated pain, are among the other medications that may be prescribed. Medications to stimulate stomach motility can be used to treat digestive symptoms from diabetic gastroparesis, which is impaired stomach motility. A referral to an autonomic disorders program at a neurological institute may be indicated. In addition, anticonvulsants such as gabapentin can alleviate nerve pain brought on by autonomic dysfunction. You can see our video on gabapentin for peripheral neuropathy in our neuropathy playlist. A link will be in the description. Before taking any medication for autonomic neuropathy, patients should consult with their physician to ensure that it is safe and appropriate for them. How can one cope with autonomic neuropathy? Adaptive strategies regarding changes in lifestyle can reduce the severity of symptom flare-ups and, in some cases, prevent them from occurring. Regular exercise and adherence to a healthy diet devoid of processed foods can improve digestive symptoms well as overall health and reduce the inflammation associated with autonomic neuropathy by preventing or minimizing autonomic neuropathy damage. Maintaining a healthy weight plays an important part in coping with autonomic neuropathy. Maintaining a normal blood sugar instead of a high or low blood sugar prevents further damage. Managing stress through relaxation techniques such as yoga or mindfulness meditation may also be advantageous for symptom management from autonomic disorders, especially if one has autoimmune diseases such as systemic lupus erythematosus. Stress management definitely helps with blood pressure problems. Preventing or minimizing an immune system attack is vitally important in preventing autonomic failure. Depending on the individual's physical condition, medical treatments may include, as previously mentioned, medications that improve circulation, stabilize blood pressure, or treat pain or other autonomic neuropathy-related symptoms. In case you haven't heard, a discovery regarding a particular enzyme involved in the development of neuropathy has the potential of revolutionizing the way neuropathy is approached. See the link in the description or in the pinned comment below. Let's recap this video on autonomic neuropathy. Autonomic neuropathy is a disorder that affects the nerves responsible for autonomic bodily functions such as heart rate, blood pressure control, digestion, and urination among others. Even one's sweat glands can be affected. Autonomic neuropathy can cause extreme fatigue, dizziness, gastrointestinal symptoms, and other potentially hazardous health issues. Autoimmune disease and a healthy immune system can play a major role in autonomic neuropathy. Blood pressure and blood flow can be affected, resulting in too low a blood pressure when standing, known as postural hypotension. High blood pressure can also sometimes develop. Many autonomic neuropathy symptoms can be managed with early diagnosis and treatment to minimize the nerve damage and autonomic failure. Body functions can be nearly restored to normal if the autonomic disorder is diagnosed early. Autonomic neuropathy cannot be completely cured, but it can be managed with lifestyle adjustments and prescribed medications. Some of these medications are also used to treat peripheral neuropathies. The symptoms of autonomic neuropathy depend on the individual, including age and other comorbidities. A recent enzyme discovery is changing the way people are approaching neuropathy. Check the link in the description below or in the pinned comment. We hope you have enjoyed watching this video. Please like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our neuropathy playlist. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice or a substitution for a physical exam by a doctor. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.